Yes, ma'am.
Yes.
Yes, ma'am.
So be alert. We are going to start with this session, and in between, I'm going to ask you questions as well. This is my pattern of teaching. I'm going to ask you questions in between. So if you're not answering, you'll not get attendance. Make sure that. Okay. Okay. So today we are going to start with scalp. What is scalp? Let us understand that. This will be taught in the following headings. Okay. First will be the definition. What is the definition of the scalp? When we are talking about the scalp, it is a soft tissue which covers the vault of the skull. Okay. When we are talking about the skull, let's take this is the head. Okay. Head and neck. When you are differentiating, what are the lines which separate the head from neck? That is very important for you to understand. What are the differentiating lines? When you go back of your head, there is external occipital protuberance. That means when you hold your skull on the back side, there is a small elevation on the back side, that is called as external, which is outside occipital protuberance. Protuberance is an elevation. Occipital refers to the occipital bone, which is on the back side. Okay, what is it? External occipital protuberance. So protuberance, external occipital protuberance, which is on the skull, on the back side, on both of that protuberance, we have two lines. These are called as nuchal lines. What are the lines? Nuchal lines. Nuchal. Nuchal lines. Okay. So these external occipital protuberance and the nuchal lines, this is somewhere over here for me. So above this is the head and below that will be the neck region. Okay. So that is a demarcating line between the head and the neck region. Am I clear till here, everyone? So what is the demarcating line? External occipital protuberance in the middle and superior nuchal lines on both sides. So this will demarcate the head from the neck region. So neck is not just here. This is not the constricted portion. Only this much is not the neck. Neck is extending a little bit on the back side of your occipital region as well. Okay, please keep that in mind. So now we know what is the differentiation between the head and the neck region. Now, what are the various regions which are important for us? Let us understand that. Okay. So just give me a minute.
Ma'am, can you repeat it?
Yes, I'll just get the skull for you. Just a minute. I'll show it on the skull. Okay, now you are looking at the skull model. Okay, so this is the entire skull with blood vessels. So don't worry about the blood vessels. Now what you are looking at is, this is the vault of the skull. Okay, the skull cap is called as vault of the skull. Okay, the entire thing is called as cranium. Okay, cranium. This is the mandible. Mandible, cranium. Cranium has got skull cap or the vault. Okay, now on the back side, now we are trying to understand what is the difference between the head and the neck. What is the demarcating area between head and the neck region? So let's say this is on the back side of the skull. Can you all see? This is the front. Okay, this is the lateral region and this is the back. On the back side, we have got an elevation. Can you all see this? This is a elevation here. This is called as external. When I say external, there should be an internal. Otherwise, I'll just say occipital protuberance. Because there is one on the outside and one on the inside, I'm telling you external occipital protuberance. Okay, am I clear here, everyone?
Yes, ma'am.
Yes,
Yes,
ma'am.
Okay, so this is your external occipital protuberance. Okay, an elevation, you can see that elevation on the occipital bone. On the back side, you can see this is the occipital bone. So external occipital protuberance, and on both sides, we will see nuchal lines. Okay, this you can see only in the original skull. That lines cannot be seen like lines, we have to feel them, we have to feel with our fingers, then we can see that there are slightly elevated lines on both sides. So this will demarcate, let's say this is the occipital protuberance and both sides we have superior nuchal lines. So above that, this area is called as vault, okay, the skull cap, okay, and this region is called as head, and below this region, this entire region becomes the neck. So demarcating line are called as nuchal lines. Nuchal refers to neck region. Nuchal, nuchal lines. Okay, clear? External occipital protuberance and superior nuchal lines will separate the head from the neck region. Right? Clear till here, everyone?
Yes, ma'am.
Yes, ma'am.
Yes,
Okay.
ma'am.
Now, what is scalp? Scalp is a soft tissue which covers the vault of the skull. Okay. Now, what is the vault of the skull? You know that this is the vault of the skull, skull cap. Okay. Soft tissue which covers the vault of the skull is called as scalp. What is, see here in the definition it is given, it's a soft tissue covering norma verticalis. Norma means what? What is norma? Norma means the view, how we are looking at it. So various views are there for understanding the skull. Theoretically, we are studying skull in various views. What are the various views we will see? From above, if you see, it is called as norma verticalis. From the front, you see, it is called as norma frontalis. From the side, you see, it is called as norma lateralis. Okay. From back, you see, it is called as norma occipitalis. Now from the base, you see, that means you will see base of the skull. So that is called as norma basalis. So once again, I'll just repeat this. What are the norma? Norma means the view, how we are looking at the skull and learning. What are the various views? We have norma verticalis, norma frontalis, norma lateralis, okay, norma occipitalis, and norma basalis. Okay, once again, norma verticalis, from above we are looking, norma frontalis, norma lateralis, okay, norma lateralis, norma occipitalis, and norma basalis. Okay, so now what we are telling, what is scalp? Scalp is a soft tissue which covers the norma verticalis, okay, or the vault of the skull. Now let us understand what is the extension, from where to where this scalp is extending. Okay, the heads are very important. Okay, what are the extensions?
Ma'am, can you,
Yes, Harsh.
ma'am, actually I cannot see your video properly, like explaining the part of skulls.
Okay, rest of you, can you all see?
Yes, ma'am.
Yes.
Yes,
Yes,
ma'am.
ma'am.
No, ma'am.
Okay, please.
Ma'am, I cannot pin you actually, so that I can see your video continuously because I'm getting interrupted with the names of the class.
Okay, I'm pinning my screen so that you can see this without interruptions. Are you all clear? Can you all see?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So now we have discussed what are the norma. Norma means the views of the skull. Okay. How we are looking at the skull. What are the various views? One is from the vertical view, that is from the above. So this is called as norma verticalis. From the front, norma frontalis. From the base of the skull, it is called as norma basalis. From the lateral view, this is called as norma lateralis, and from back side, it is called as norma occipitalis. So what is scalp? Scalp is a soft tissue which covers the verticalis of the skull, or it is also called as, it's a soft tissue covering the vault of the skull. That's the definition. Now let us see what is the extent of this scalp, from where to where it is extending. Okay, now see here extension, here in the picture also it is given, and whoever can see, please try to see this video also so that you can understand on the skull itself. Okay, it extends from superciliary arches. What are superciliary arches? These are the orbits. Okay, you can see the orbits. Above the orbit, this upper margin of the orbit, this is the superior or margin of the orbit, and above this we can feel where our eyebrows are present, right? You can feel on your eyebrows also, you can see that there is an elevation of the bone. You can feel the elevation of the bone here. So these are called as superciliary arches. Okay, please note down because these words are very difficult to understand. I will send you the PPT as well, but you have to write down. Okay, superciliary arches. Super means above, ciliary, ciliary means eyebrow, superciliary arches. Okay, the bone which is arching. So these are called as superciliary arches. From there it starts. Okay, anteriorly to the occipital protuberance on the posterior side. So where is the occipital protuberance? This is the occipital bone, and this elevation is called as occipital protuberance. Okay, we can see an elevation. In some people we can clearly feel it also. In males especially, we can feel that external occipital protuberance is high. Okay, so till from the front, from superciliary arches till the external occipital protuberance on the back side, this entire extent is covered by scalp. On the lateral sides, now on the lateral side we are studying what is the extent on the lateral side. Lateral side, it is extending till where? It is extending to the zygomatic arch. So can you see this bone on the both sides? Okay, both sides we can see cheekbones, these bones. Okay, so please try to feel it in your body also so that you understand naturally what it is. So here and here you have cheekbones. So these are called as zygomatic bones. What are these bones called as? Zygomatic bones. And this arch on the sides, what you can see, this is called as zygomatic arch. Okay, so the scalp is covering on the lateral side till the zygomatic arch. Okay, so that is the extent of the scalp. Anteriorly till where? Anteriorly it extends till the superciliary arches. Okay, posteriorly till the occipital protuberance, and on laterally it is extending till zygomatic arches. Okay, so this is the extent of the scalp. Clear till here, everyone?
Ma'am, can you please repeat this again?
Okay. So can you see that? Can you see the skull once again? We'll repeat all the areas. Okay. So what are the areas? Front, we can see superciliary arches. From the extent, if you feel the ciliary arches, that means our eyebrows region. You can see that our bone is slightly elevated. Okay. Can you all feel that? So this is the superciliary arch. So anteriorly from superciliary arches, till where? Till posteriorly occipital protuberance. Where is the occipital protuberance? Here. So till the external occipital protuberance the scalp is extended, and on the lateral sides till where it is extended? Till the zygomatic arch. So this is the zygomatic arch. Okay, that is an extension from the zygomatic bone. So till here your scalp is extended. Okay, so that is the extent of the scalp. Everyone clear till here?
Yes,
Yes.
ma'am.
Extension and extension.
Yes, ma'am.
Now let's see what are the layers. Okay, layers of the scalp. There are 5 layers of the scalp. As the name suggests, SCALP. Okay, what do you mean by S? S means skin. Okay, whatever we can see outside, this layer is the skin layer. Okay, S stands for skin. Okay, C stands for connective tissue. Okay, A stands for aponeurosis. Guys, please mute yourself.
Ma'am, your voice is lagging.
Okay. All of you, please mute yourself. Okay. Can you all hear me properly? One of you, please answer.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay. So here we can see, all of you please mute so that we don't get this connectivity issues. Okay. So there are 5 layers: S, C, A, L, P. Okay. What are the layers? S stands for skin. Okay. Now I remove the skin from the scalp. Then what I'll see? I'll see connective tissue layer. Okay. After connective tissue, there is a layer called as aponeurotic layer. Aponeurotic layer. Okay. L stands for loose areolar tissue or loose connective tissue. P stands for pericranium. Today we are going to understand all these 5 layers. Okay, maybe next Monday onwards you will be directly dissecting from the scalp onwards. Okay, so what are the layers? Once again we'll revise. S stands for skin, C is connective tissue, A for aponeurosis, L for loose connective tissue, and P for pericranium. Okay, now we will see each one in detail. Okay, what is scalp proper? Okay, so what is the first layer? This first 3 layers. Okay, skin, connective tissue, and aponeurosis. These 3 layers are adherent to each other. So when you are dissecting, what happens? You make incision and you start reflecting the skin. It will not come layer by layer. Okay, why they are not coming layer by layer? First 3 layers: scalp, connective tissue, and this aponeurosis. All the 3 layers come together first. Why these 3 layers come together first? Because these 3 layers are very much adherent to each other. Because of the second layer, what is the second layer? Connective tissue. This connective tissue is very thick. Okay, it's very thick that it adheres to both first and third layer. So that's why when you are stripping that scalp from the vault, you will see that first 3 layers come off very easily. Okay, so that's why these 3 layers forms the scalp proper. Okay, what is a scalp proper? All the first 3 layers: skin, connective tissue, and aponeurosis. All these 3 layers together are called as scalp proper. Why scalp proper? These 3 only, because these 3 are adherent to each other, and anytime whenever we have any injuries and all, so these 3 layers come together quickly. Okay, so that's why this is called as scalp proper. Now, what are the other layers? Let us see one by one. Okay. Now, each layer has got applied aspects. What are the applied aspects also we are going to study? So, if you see skin, okay, which type of skin it has? So, remember that we are going to study soon later on integumentary system in general anatomy. That skin, we have 2 varieties of skin. What are the 2 varieties? Thick skin and thin skin. Okay, thick skin and thin skin. What is thick skin? The skin which is lying on the palm of your hand and sole of the foot is called as thick skin, or it is also called as non-hairy skin. Okay, there is no hair on the skin, so this is called as thick skin or non-hairy skin. Now the skin which is on the back side, okay, rest of the body, it is called as thin skin, or it is also called as hairy skin. There are hair follicles on it. Okay, so, so this is called as thin skin. Now which variety we are looking on our scalp? It is a thick variety of thin skin. That is a special feature of scalp, because the skin itself is very thick. It is a thick variety, but it has got hair follicles. So that's why we always mention whenever we are saying it's a thick and hairy skin. Okay, am I clear till here, everyone?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, so what is the type of skin we are looking at? It is a thick variety of thin skin. Now, whenever we are talking about hair and the skin, remember that it has got lot of sebaceous and sweat glands. Okay, sebaceous and sweat glands are pouring their secretions where? Into the hair follicles, because these are the areas where the secretions can come out. Okay, so when you are studying histology, you will know more better where exactly these hair follicles are there. Okay, so where the sebaceous glands are there, where the sweat glands are there. So all the glands which are present in the skin, the dermis of the skin has got two layers, epidermis and dermis. Epidermis is outside and dermis is more deeper. So within the dermis, you will have lot of sweat and sebaceous glands. These all glands will pour their secretions where into the hair follicle. Okay, so from this root of the hair follicle onwards, we get the secretions outside. So this is the most important point. Why it is important point? For example, what happens whenever there is kind of dandruff, okay, or some dust particles or anything, you are not cleaning your scalp properly. So what is happening? So all that material can get stuck at this hair follicle and close the opening of these secretions. Now what happens if these openings are closed? Secretions are though happening, but they're not coming outside, so that is blocked. So because of that, what happens? Sebaceous glands or sweat glands swell. Okay, do they have place so that they can nicely enlarge here and here? No, they cannot. For example, if you have a sebaceous gland infection over here, they cannot spread because what is happened? The variety of skin is very thick. Okay, and because of that, what happens? The cysts are very small. What is a cyst? A infectious fluid filled sac is called as a cyst. Okay, there is a sac which is filled with infectious fluid. That can be any tissue fluid, it can be pus, it can be blood. Okay, these are called as cysts, and this cyst cannot spread, cannot come bulge outside also very much, because they are very much, the skin is adherent to the connective tissue. So because of that, what happens? These cysts are small in size, but they're very, very painful. Okay, so what is the applied aspect of the skin layer? Skin layer, we have got sebaceous glands and sweat glands in the dermis, which secrete into the root of the hair follicle, which can come out. Okay, but what happens when that pores are blocked by any kind of infectious material, dust particles, dandruff, or anything? So that can block the openings of the sebaceous glands, and because of that, we might see sebaceous cysts. Now, cysts are small in size because they have no enough space to move. What happens is they are very, very painful. Okay, so this is the applied aspect of the skin. Clear till here, everyone?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Now
Yes,
let us
ma'am.
understand connective tissue. Okay, let us understand about connective tissue. Now, when we are talking about, this is the diagram you are supposed to draw. Okay, so this is the 10-mark question, long question. So first you have to define, extent, then layers you have to explain. So each layer you have to explain. So this is the diagram you are supposed to draw, which is given in your textbooks as well. Okay, now connective tissue is very, very dense here. Remember that it's a very dense connective tissue, very important layer. Why it is important, I'll tell you. Within this dense connective tissue, we have got blood vessels. Okay, all the blood vessels of the scalp are present within this connective tissue, second layer. Okay, so and the fibers inside connective tissue is made up of what? Connective tissue is made up of the collagen fibers, reticular fibers. All these fibers are so thick here, so thick here, because of their the presence there, the fibrous tissue is so thick. Okay, there is no enough space, and what happens is the blood vessels are inside it. So what happens if there is a cut to this blood vessel? The blood vessels cannot retract. Remember that whenever there is a cut on your blood vessel, immediately blood vessel shrinks to reduce the, to minimize the flow of the blood outside. Okay, so that shrinking of the blood vessel is not happening here in the connective tissue. Why it's not happening? Because the blood vessels are nicely held by the outer connective tissue. So what is happening? The blood vessel lumen is remaining like this, it is not shrinking, it is present like this. If there is any cut here, lot of blood is oozing out. That's why you will see any injuries on the scalp bleed profusely. Okay, you have profuse bleeding of the scalp cuts. Why there is profuse bleeding? Because the connective tissue is very, very dense. So if there is any cut, to the scalp blood vessels, immediately start hemorrhaging very much. Okay, so this is the applied aspect of the connective tissue. Clear everyone? Connective tissue?
Yes,
Yes,
ma'am.
ma'am.
Yes.
Yes, ma'am.
Now let's see the next layer, which is very important layer, that is aponeurosis. What is okay, let's, before going to that, we'll just read out what is written here. It is a fibrofatty tissue which is adherent to the skin and to the underlying aponeurosis by the fibrous septa. Okay, a lot of fibrous septa are there between these two layers. It is richly supplied with vessels and nerves embedded with it. Okay, so next layer is called as aponeurotic layer. When I'm saying aponeurosis, what is aponeurosis? The meaning of aponeurosis is it is a flattened tendon. Okay, what is aponeurosis? It's a flattened tendon. Where is the tendon? Where is the tendon, guys? Where will you see a tendon? Anyone?
In between
And
ligaments.
muscle to bone.
Yes. So whenever a muscle is attached to a bone, you will see that the tendon is present. Okay, that is nothing but the connective tissue surrounding the muscle is called as the tendon, which is coming for adherence or attachment to any ligaments or something like that. So tendon means it is associated with muscle. Now this tendon is a rounded structure. Now if I am spreading it like a sheet, okay, so the spreaded or flattened tendon is called as aponeurosis. Okay, so whenever I say aponeurosis, that means it's a flattened tendon. And second point, what you have to remember, it is linked with a muscle. Okay, so what are the muscle here? There are two muscle bellies. Okay,
Ma'am, can you repeat?
aponeurosis means it is a flattened tendon. Okay, next point to remember is it is connected always to a muscle. Okay, so this layer, third layer, has got a muscle and a flattened tendon. Okay, together this will form the third layer. So what are the muscle bellies we will study first, and then we will understand about aponeurosis. Okay, muscle bellies, what are the muscle bellies? We have frontally, we have frontal bellies. Okay, here it is given frontal bellies, and posteriorly you have occipital bellies. Okay, belly means a muscle bulge. So you have two bellies. Okay, frontal bellies and occipital belly. Okay, all this muscle gives their connective tissue fibers. This flattened tendon forms an aponeurosis. This aponeurosis joins the frontal bellies with the occipital bellies. So both of these muscles are connected very strongly with this aponeurosis. Since this aponeurosis is above the vault of the skull, this is called as epicranial aponeurosis. Okay, what is it called as? Epicranial aponeurosis. Epi means above, cranial means the skull. Okay, so this aponeurosis is called as epicranial aponeurosis. Clear, guys? So here what you have to understand in this layer, what is aponeurosis? Okay, next you have to understand how the aponeurosis has been formed, how the muscles gives a flattened tendon to form an aponeurosis, and what is the aponeurosis full name. Okay, it is called as epicranial aponeurosis. Okay, now together means the frontal bellies, occipital bellies, and the aponeurosis together is called as Galea aponeurotica. Okay, what is it called as? Galea, Galea. Okay, Galea, Galea aponeurotica. Okay, so this third layer is called as Galea aponeurotica, which contains frontal bellies in the front and occipital bellies on the back. Okay, along with epicranial aponeurosis. Till here, everyone clear?
Yes, ma'am.
Yes, ma'am.
Now only this third layer will come as a short
Yes,
note
ma'am.
question. Okay, only this third layer will come as short note question. Why? Because whenever we say about a muscle, we have to tell where it takes attachments. Okay, what are its attachments means where exactly it is attached. So why? Because it moves, right? Movement is there. So that's why we need to understand its muscle attachments. That's why this question will come as a short note question. Only the aponeurotic layer. The question can come like this: Galea aponeurotica, 5-mark question, yeah, 4-mark question. So you need to explain the muscle attachments, nerve supply, and actions. Clear till here, everyone?
Yes, ma'am.
Yes, ma'am.
Okay. Now let us understand the muscle attachments, occipitofrontalis muscle. Okay, what is this occipitofrontalis muscle? We will see. Now see here, the skin, once we reflect the skin, we see connective tissue like this. Then we see aponeurosis like